You will. Right, start. Respected chairpersons, Professor Garg, Dr. Reddy, Dr. Dholakia, I am presenting Ophthalmology Residency Training in India, 20th versus 20th century, what has changed. This had come from the Residency Evaluation Adherence Design Study that was done 2 years ago. We know that the residency training system in India is a bit like a Gurukul system where a student follows, observes, learns, and then works for 2 to 3 years. But then in today's world, no one can know all. The last one to do that was Leonardo da Vinci about 400 years ago. So teachers have to become facilitators of knowledge. So the READ study was to look at feedback from young ophthalmologists who had done their residency in the last 10 years. So they were young enough to still remember what was taught to them, but old enough to understand how that residency is helping them in today's lives, and comparing them with people who were trained in the 20th century. And this was to help the All India Ophthalmology Society frame guidelines for residency training. And we know that India has changed a lot. We have 400 million children, 120 million adults. Cataract is no more the most important cause of blindness. Retinal diseases have increased, so has glaucoma, while corneal infections have slightly reduced. And here, this was a survey that was done all over the country in which almost 5,000 people were targeted, and we have a sample size of more than 1,000. The respondents were from 28 states and union territories, so it's a pan-India sample that we have. And when we look at them, we find that an average age of the 20th century trained is about 47 years, 21st century trained is 32 years. There are, of course, lesser number of males in the 21st century group. Again, when we are looking at second generation doctors, they are again more in the 21st century group. Coming from a family of ophthalmologists is also more in the 21st century group. And in both of them, ophthalmology was still the top choice of their career when they had chosen their residency. So ophthalmology as a career we know is lucrative, has no emergency hours, people can devote time to family and hobbies, so that has stayed. But when we had asked them to rate their clinical skills from a 0 to 10, we were, well, pleasantly surprised to find that in almost all skills, slit lamps, pachymetry, A scan, plus 78D, B scan, keratometry, in almost all of them, obviously, the 21st century trained doctors were saying that their training was much, much better. But when we are looking at for glaucoma diagnosis and management, again, for most of it, it is much better. But if we are looking at the number of trabeculectomies, those who are trained in the 20th century, they were doing about 25 trabeculectomies on average. The median was 5, but for a 21st century trained, they were hardly doing any trabeculectomies at all. Perhaps that was because there is more of medical management of glaucoma. Again, when we are looking at retina-related skills, well, in all of them, the retina-related skills, there was a great improvement. But when we look at skills for children's eye care, there is not much improvement. In fact, orthoptic evaluation, synoptophore, diplopia charting were taught better perhaps in the last century than they are today. Again, when we are looking at surgeries performed independently during residency training, we find that ICC now has just gone. Small incision cataract surgery is the most common that is done. But a median 21st century trained resident is still doing only one phacoemulsification in his or her residency. And if we look at non-cataract surgeries, it's much, much lesser. Even the SAC surgeries have reduced. Even for taught academic programs, there is not much difference, but again, wet labs and journal clubs are not being used that much. Even when we look at how much the dissertation that is done during residency is published, again, for that, it's not very high. Well, we did not look at all these things when we did the reads, which is also important in the residency training. But what we got to know is, the good is, ophthalmology is still a sought-after choice. More second-generation doctors are choosing ophthalmology. Almost all clinical skills, their teaching and exposure has improved in the past decade. Exposure to cataract surgery was adequate, but was not uniform. And there are, of course, more women in ophthalmology. But the weakness is that 5 states have half of India's ophthalmologists. Exit exams are mainly theoretical. Practical examinations are inadequate. Journal clubs, wet labs are underutilized, simulators are hardly used, non-cataract surgery is not adequately taught. There is no pre-entry assessment. Well, we have great institutes which are islands of excellence, but they are in some ways an oasis in a desert of mediocrity. Because the ugly, the take-home message is that there is a lack of standardization. Some of the best in India is comparable to the best in the world, but we still have a huge variation, and for all forms of teaching, clinical, surgical, and academic, on a range of 0 to 10, each has been scored 0 by a respondent, and the standard deviation